Hello, I'm Laura Nabors, and I have developed a book entitled Information for Mental Health Providers Working with Children Who Have Chronic Illnesses. I'm pleased to share a few ideas about this book. The purpose of this ebook is to be a resource for clinicians and health professionals working with children who have chronic illnesses, as well as to give them some ideas for working with their families, including parents and siblings. The broad focus of this book is to improve adaptation of children who have chronic illnesses and build their strengths as they cope within their communities and as they develop throughout their lives. The two forewords for the book indicate that this book is useful for health educators, health professionals, and mental health providers. The forewords were developed by Dr. Keith King and Dr. Jessica Kitchler and are available free of charge and can give you an idea about the utility of this ebook. Topics covered in this book vary, and they include impact of chronic illness on the child and family, as an introduction to get the book started and get the reader introduced to the topic. Ideas for facilitating child coping. A chapter on therapeutic interventions to help the child adjust to his or her illness. Chapters on assessment of child functioning at school and helping the child cope and thrive at school offer insights to success in the school setting. Then there's a chapter on parental adjustment, helping siblings of the child with the chronic illness cope, and siblings often need help when their brother or sister has a chronic illness. And finally, a chapter on transition to adult medical services. A lot of children with chronic illnesses become very comfortable in their pediatric care homes and need extra assistance at times when they need to transition to adult health care services. It's important to mention that this book has a resilience focus. I tried to come from a strengths-based perspective in discussing the lives of children with chronic illnesses because many of them do very well, or they have very brief periods in which they have a little trouble dealing with their illness or medical procedures, and then they snap back to doing very well in their daily lives. Therefore, the clinician needs to have a rubber band approach to move with the child and family and be there as needed and hang loose, so to speak, when things are going well. In each chapter, there are case studies showing successful outcomes to be used as a teaching tool or to provide examples of how therapy cases can turn out well. The book is intended to be useful for beginning clinicians or those wanting to get their feet wet in the field, as well as those who are health professionals and interested in working with children with chronic illnesses. Many of the chapters have a community orientation with the idea of meeting children where they are to improve their skills and strengths. I hope you enjoy this book and that it will be useful in enhancing your skills for working with children with chronic illnesses and their families. Thank you.